Turning now to the health implications these weather events could pose, we're joined by Kate Tulenko. She's the founder and CEO of Corvus Health, and she joins us now from Alexandria, Virginia. Kate, thanks for joining us. Of course, we're seeing heat waves and flooding across the country at the moment. It seems like the climate has reached a new level of danger. People around the world, however, are living longer. They're living healthier lives than they were just half a century ago. How is climate change threatening to undo all of that progress?
Yes, so climate change is threatening that progress in a number of different ways. First are the most acute effects, people dying from severe heat, people dying from cold, dying from flooding. But probably the larger effects are the more indirect or long-term effects. For example, people dying from malnutrition or starvation because crops are going to be affected and crop yields are going to fall, or people being displaced by flooding. For example, currently about 40% of the world's population currently lives in coastal areas. That's about 100 kilometers from the ocean. And so these people are going to be displaced as the oceans rise. And so that means that all the infrastructure, the medical infrastructure, will need to be rebuilt. Health workers will probably leave poorer countries and migrate to wealthier countries. Also, we'll see changes in where certain pathogens, whether it's bacteria, viruses, or mosquitoes, ticks, where they live. And for example, we've seen malaria now transmitted in the U.S. for the first time in decades.
So how do erratic weather patterns play into that? I mean, periods of extreme drought, flooding, do create conditions for disease to spread. Just tell us a little bit about that process.
Certainly, especially the insect-borne diseases. Most insects need warmer weather in order to live. So as the belt of warmer weather rises to the north, in the northern hemisphere, and to the south in the southern hemisphere, we'll see malaria spread, we'll see important tick-borne disease spread, but also the World Health Organization estimates that about half of the pathogens that cause human disease will be more likely to infect people when the world gets warmer. So there are a number of different ways that will feel this effect on life expectancy and health in general.
You mentioned climate migration, infrastructure, what needs to be in place to be able to manage the mass movement of people as the climate changes around the globe. Do you think that we're in the current state that in terms of our global public health, that we can manage such a thing?
No, unfortunately, I don't think we are. We saw how difficult it was even just to manage, COVID, which was a single pandemic event. It's estimated every year that climate change or climate variability displaces 20 million people. So that's a population the size of Romania or the size of Syria every year being displaced. And so currently, we haven't, put together the infrastructure, we haven't mobilized the resources to address that. And that's why it becomes so important that countries reduce the consumption of fossil fuels or try to do carbon capture or reduce deforestation so that hopefully we can cool the earth a little bit and prevent that rising of the oceans.
You mentioned the COVID-19 pandemic, an example of perhaps how complicated the public health response needs to be to such a pandemic. What have we learned from the coronavirus epidemic or pandemic? How is it in terms of global wealth? Is there more investment and interest in terms of countries taking responsibility and funding that global pot of public health infrastructure?
Well, certainly with COVID, we did see increases in investment in early warning systems, systems that look at wildlife and the chance that disease will be transmitted from them to humans. We did see an increase in health infrastructure, an increase in training of health workers, but it really, unfortunately, is just not going to be enough. We need larger investments in this, which is going to be a challenge in the setting of, the current global economic crisis, the war in Ukraine, with them not able to get the grain out to some of the poorest countries in the world. It is very concerning.
Kate Tulenko, really appreciate your time. Thank you.